Hey, it's Cassie from The Bird Show, and I'm here with some really important information for you. Now, you kind of already know this, but most of us put this on the back burner, and I'm letting you know it's time to move it to the front burner, okay? Have you ever thought about what you would do if you found a lump in your breast? Have you ever scheduled a mammogram, or do you keep putting it off? Do you know how to schedule one? Does your insurance cover it? What would you do if you got diagnosed with cancer tomorrow? Who would you tell? Who would you talk to? Did you even know there are different types of subcancer? Did you even know you can get genetic testing to find out if you're at risk for a breast cancer? All of these questions we're going to answer. I've got Dr. Amelia Zelnak here from Northside Hospital. She's going to remove some of the mystery around these questions so that you're armed with the knowledge to talk to your doctor about what's best for your health. Now, let me tell you a little bit about why we're going to want to listen to Dr. Zelnak, okay? Before joining Atlanta Cancer Care, she was on the breast oncology faculty at Emory University. She's published multiple peer-reviewed research and review articles on breast cancer, has spoken at regional and national meetings on the management of breast cancer, and she's also served as the principal investigator on numerous breast cancer clinical trials. She also serves on the Georgia Core Board. Dr. Zelnak, thanks for being here today. And as someone whose family went through this recently, I have to say the oncologists that we work with are such a critical piece of the care team, not only in terms of the science, but in terms of looking after patients. So genuinely from my family to you, thank you for everything that you do. Not to make it awkward and weird as I open up the interview like this.
I'm so sorry about your mom.
I appreciate it.
Yeah.
It was multiple years. We knew it was coming, but what I found most helpful in going through this whole process is really seeing the breakthroughs in the research. But what I wanted to ask is, it seems like more and more people are getting diagnosed younger now. Do you think there is more prevalence of breast cancer, or is it that cutting edge technology has allowed us to identify it earlier when folks are younger?
So if you go actually look at the statistics, there's been like a slight increase in rates of breast cancer overall in women of all ages. But the rate of increase has been a little bit faster in the younger women. I think part of it may be that I'm just getting older, and so it seems like we've got more young patients. But, for women that are under 45, it is still the most common cancer diagnosis that you may get is breast cancer. I mean, that hasn't changed for many years. But I do think there's been a slight uptick. Hard to know exactly why. There are probably a lot of factors. Women are having their children later. There's more challenges with obesity now here in the U.S. I think people are drinking more, like some of those things that are kind of the softer, impacts on your breast cancer risk. I think that may have impacted the younger patients being a little bit more at increased risk. But the main thing is that you've got to get it worked up, right? I mean, as you see what's the biggest impact on prognosis for a patient, it's what's your stage when you come in. And so for those women that have their cancers detected on a mammogram, they're typically going to have a much better prognosis than if you come in with a lump or a bigger mass. And so it's really important to go do the screening mammograms, but then also if you feel a lump, to go get it taken care of right away.
And see, I'm so glad to hear that, because that's my thing is sometimes I think it's so easy to get into the cycle of your life. And when you're feeling healthy, just put off the mammogram. I don't need to do it. But the earlier you catch it, the more likely you're going to have a good prognosis, right?
Absolutely. I unfortunately hear the stories from patients about, well, I didn't want to interfere with the summer with my kids and the vacation. I'm like, well, my goodness, if you felt the lump back in April, why are you just coming in September? So, it's just important to really be proactive, to go see your doctor, to have them do the exam, send you for the imaging, because there are those more aggressive cancers that show up even in between your mammograms. So if you're going every year, there are some patients that faithfully have had a mammogram, and then 8-9 months later they've got one of the faster types of cancers. And so if they don't go until they're due for their mammogram several months later, that can really impact how much treatment they might need and then what their prognosis is.
So who should be getting mammograms? Because I've heard you should get it annually if you're 40 and over, but are there other people who maybe are under 40 who should be getting mammograms? Like, what's that person look like?
Some patients are at higher risk for getting breast cancer. So for sure, if you've got a strong family history, you should talk with your primary care doctor about, do you think I should get my mammogram done earlier? Northside now has a high-risk clinic for some of these patients to go to, or anybody can go, but there are a lot of women that are trying to figure out, am I a good candidate to do some imaging earlier? If you have one of these breast cancer genes that puts you at risk for getting breast cancer, those women often start their imaging at 25. and that would include an MRI in addition to the mammogram. So if you don't know you have one of those genes, you wouldn't know that you needed to do the screening, right? So when you think about younger women being proactive, I think knowing that you have a genetic mutation can really change what you do with your screening as well.
So, if you have a family history of breast cancer, do you recommend then that younger women go in for genetic testing? And is that something Northside can help with?
So it's interesting. This past year, when I went for my own mammogram, they now have this new risk assessment tool that they do while you're in there waiting to get your mammogram done, and it's really focused on helping identify the patients that would be good candidates to go get the testing done, right? But you got to remember the people going to get mammograms, they're going to be 40 and up. So, we're now working harder to identify people for the testing that are already doing the mammograms because they may want to do extra MRIs or additional monitoring. But for those women under 40, it's really driven by, do I have a family history? And do I want to go get testing? So, of course, we've got genetic counselors that will meet with you and go through your family history and decide whether or not you're a good candidate for the testing. But until you've actually thought about it and decided to go do it, you don't know, right?
If I'm sort of maybe your average 20 or 30 something and I don't have a family history of breast cancer, so I'm not thinking about mammograms yet, but I find a lump. What do I do? If because that can be a very scary experience, and I know most people find it and they're like, "Oh, maybe it's just a cyst or a swollen gland." But what should you do in that instance?
You need to go see somebody like right away. I think if you're already with a gynecologist, that's probably where most of the women in their 20s and 30s go, right? They may not be seeing a primary care provider every year, but most people are seeing a gynecologist, and they often are going to see you, do an exam, and then immediately get you in for your breast imaging.
And if, God forbid, they're diagnosed with breast cancer, and this is some information I wish that we had
Mhm.
when we entered into this I don't want to call it a journey because I feel like journey is uplifting, but this sort of long haul diagnosis and treatment, you know, if they are, what happens? What's next?
So once you go get your workup, like with the initial imaging, the next thing that happens is a biopsy. You got to wait a couple days to get the results back. And then once you find out you have cancer, people want to see a surgeon as soon as possible. So typically the first stop is with one of the breast surgeons who's then going to, figure out what the plan is going to look like as far as do you need to do surgery first or do you potentially even need to get chemotherapy first if it's one of the more aggressive types of cancer? But typically, the first stop is with the breast surgeon once you've been diagnosed with cancer.
And once you've been diagnosed, I know you'll go through the stages. You'll get diagnosed with like stage one, two, three,
Hmm.
four. And I know there are different subtypes of cancer as
Sure.
well. Why is it important to know, like, what is it, HER2 new? Or
Right.
why is it important to know these subtypes as well?
So even though breast cancer patients are taken care of by the same team, right? You're going to have a surgeon, you'll have a medical oncologist, maybe a radiation doctor. The treatment for the breast cancer really varies based on what subtype it is. And so there are three main types. The most common type is where the tumors are hormone driven. And then the other two less common types are the triple negative breast cancers and then the HER2 positive breast cancers. But the treatment path for them, like whether or not you need chemo, those decisions are made differently depending on what type you have. So when you go see the surgeon, you might not yet have that information back about do I have triple negative. Sometimes that comes a couple days after.
Mm.
And so you might meet the surgeon and they may say, gosh, I think you're a great candidate for a lumpectomy. But if it then comes back as triple negative or HER2 positive, they're going to tell you, you need to go see the medical oncologist to get chemotherapy first because that's the right way to go about treatment for those patients. Um, so I think, knowing that you have cancer is really important because it tells you, okay, I'm about to start down this path. But the information about the stage and then the receptors, that really impacts the overall plan.
And I know walking into it, when you're somebody who is not really exposed to cancer and
Mhm.
treatment, you only know what you've seen on TV or in movies, and getting a diagnosis like that can be
Yeah.
terrifying. But I've seen so many TV ads about people living with stage
Mm.
4 or metastatic breast cancer. And as I mentioned, my mother was one of those. And we had 4 beautiful years with her because of treatment by
Mhm.
oncologists and a specialized care team who really took care of her. So What would you say to someone about their prognosis, someone who's just been diagnosed with cancer and perhaps has found out it's stage 4 or metastatic cancer?
So for the metastatic cancer patients, breast cancer patients, the prognosis or how long people live on average also varies based on the type.
Mm.
And so patients that have HER2 positive or the hormone receptor positive breast cancers right now are living longer than the patients that have triple negative breast cancer. So with the early stage patients, we're doing, well in terms of how many patients are cured with all three types. But when you have metastatic disease, your receptors up front are going to impact both the treatment options and then also the prognosis.
How lovely that the not only the clinical researchers, but these patients who are struggling with probably something that's the most difficult thing they've ever had to handle in their lives are making the world better for the next
Hmm.
generation of people. I think that is probably one of the most selfless things you could do.
Yeah.
Because it would be so easy to just, and everyone would say, yes, you deserve to just go sit in the corner and cry because you've been handed this terrible sentence. And yet, to see places like Northside helping these patients and these women coming forward and being like, you know what, I'm going to try and make it better for the next person. That warms my heart because, again, I don't think my mom would have been around as long if it weren't for people like that.
Yeah.
So let me ask you really quickly, when it comes to breast self checks and self
Mm.
exams, are they effective? And if they are, what age should you start them?
I can still remember when they handed out the little cards to stick in the shower. I don't know if anyone remembers
Hmm.
those to remind you to do your breast self exam once a month. I think now we really talk about just being self aware. So if you're in the shower and you notice something feels different, you should go get it checked out. It's not necessarily that you need to, religiously do it every month, but just if you notice things, you should go get it checked out. I think that's really what the focus or where the focus has been on is just being aware of what your breasts feel like normally. For women that are still, having their menstrual cycles, like how do they change during the cycle? And if you notice anything that's different, then definitely go see the doctor.
So pay attention to your
Pay
own body,
attention.
basically.
Yes, yes, ma'am.
Are there any other screening guidelines we've missed that you think would be relevant to share?
And I think the main one is just you're supposed to start screening at age 40. It's surprising to me how many patients I'll meet with a new diagnosis of breast cancer that um, are 46, 47, 52, and they've never had a mammogram. So it's, again, you wonder would they have been diagnosed with a smaller tumor or an earlier stage tumor if they had started the screening, earlier at age 40.
Do you think some patients are worried about the cost of a mammogram and that's why they put it off? Are those typically covered by insurance?
Screening mammograms typically are covered by insurance. I think one of the challenges, though, is that if you're moving into the diagnostic testing, that those often are not covered as like a screening test. And so patients often are having to pay their out of pockets deductibles for the diagnostic testing. If you're actually diagnosed with breast cancer, unfortunately, um, those patients are going to meet their deductibles, by the
Hmm.
time they have surgery and whatever treatment they need, at least for that year. But that initial, gosh, do I have the money to go pay for my workup is can be hard for people. Northside has a foundation where we really work with patients to make sure that, if you need the workup, that you can get it done. But I think sometimes people are hesitant to go because they don't realize that there are resources to help them. And so I really would just encourage you to not sit back and wait because you're concerned about the cost of the workup. Please just go get worked up and then let us help you along the way.
Yeah, and the cost of treatment for later stage cancer is probably a lot more expensive than that initial screening.
Yes.
But guys, let this be your sign. I'm 39. I'm turning 40 at the end of the month, and I've already booked my mammogram for November
Good for
so
you.
that I can get screened. Dr. Zelnak, thank you so much for joining me today and telling us about breast cancer. I know October is Breast Cancer Awareness Month. Breast Cancer Awareness Month. Let me try not to trip over that. And I know that on the show, we're going to do a big push to push women over 40 to get mammograms so they can be screened. Is there anything else that you want to share today that maybe we didn't cover?
I just want to thank you for your efforts. It's just really anything that we can do to have patients go get diagnosed earlier so that they've got the best prognosis is just so impactful. You may not realize it, from an individual level, but getting people in and working them up is just so important so that we can make sure they have the best outcome.
Well, thank you to you and to Northside for doing this and helping women everywhere. Hopefully, by now, we've removed some of the mystery around breast cancer, maybe answered some questions you didn't even know you had. So, whether you're looking to just book a mammogram or you've got a lump you're worried about you want checked out, maybe you're interested in genetic testing as part of Northside's breast cancer high risk program, or you're undergoing treatment for breast cancer and you're interested in clinical trials, please know there's a team of doctors and experts at Northside Hospital who have the tools and resources to help you on your journey. And as we enter October, which is Breast Cancer Awareness Month, I implore you to book your mammogram and to convince a friend to book theirs too, because you never know, it might just save their life.